So CIFFTA is a comprehensive approach, right, to family therapy, looking at engaging adolescents and their families. So the key aspects include understanding family dynamics and how they're influenced by cultural factors, addressing the unique developmental needs and challenges of adolescents, and implementing intervention strategies that are tailored to the family's cultural context. So, as I said, it's a specialized approach to family therapy specifically for adolescents. Um, and the goal is to engage families more effectively and to address the unique needs of adolescent clients. So, we'll take a look at some of the key components. So, the family history interview is the first step in the SIFTA approach, which helps to build that engagement with the family and identify, of course, how the program can best serve them. And rather than focusing on interpersonal dynamics, the interview explores significant family events and experiences that have impacted the family members. So, this is also providing foundation for understanding the family situation and informing the intervention. The interview covers three key areas: family structure, relationship dynamics, and problem history. For family structure, we explore, or it explores really, the history of the family unit, its origins, formations, separations, and current routines. For that relationship dynamics, it's looking at patterns of closeness, distance, conflict, and support between family members. And for problem history, it's investigating when issues emerged, what interventions worked or failed, and the family's existing roles and approaches. So as we've learned throughout this class, the immigration experience can be a complex and challenging journey for families with a lot of factors to consider. So the migration journey itself, the adjustment process, and the current challenges faced by the immigrant families. So um, I know this is repetitive, but the migration journey, right, is really why is someone leaving one's home country, the route taken, the dangers encountered, and any family separation that may have occurred during the migration. That adjustment process is looking at the changes in values and behaviors, the different rates of acculturation within the family, and the resulting family stress. And then the current challenges, such as changes in social and economic status, documentation issues, support systems, and experiences of discrimination. So these are all sort of the dynamics at play. The cultural and immigration factors is really crucial for providing that comprehensive context informed therapy for immigrant families. So in terms of the adolescent component of the SIFTA program, the early sessions, which is the first through third sessions, are focusing on building trust, increasing motivation, and establishing a collaborative therapeutic relationship with the adolescent. The middle sessions, 3 through 12, third through 12th session, are covering important topics like the effects of acculturation and family separation, ethnic and racial identity development, and navigating social media and systems. The later sessions are emphasizing um, skill development, and there's overlap here, right? As you can see with the numbers, skill development, improving conflict resolution, and increasing supportive interactions. And also ultimately preparing for maintenance and relapse prevention. So, throughout the program, the goal is to validate the adolescent's experience, decrease negative interactions, and empower them to improve their mental health and relationships. So SIFTA, again, culturally informed and flexible family-based treatment for adolescents, has four phases. That engagement phase, which is helping families understand the systemic nature of their problems, validating their reluctance to participate, and building a collaborative relationship, and instilling hope. So the education phase is helping families uh, learn more about mental health systems, discussing the impact and effects of acculturation and separation, exploring ethnic and racial identity development, and understanding the role of social media and systems. And the intervention phase is decreasing hostility by shaping family interactions, improving conflict resolution skills, and helping families understand youth vulnerabilities. The skills and maintenance phase is where we're teaching parents communication skills, providing guidance and monitoring techniques, and identifying triggers to family conflicts, ultimately, also reinforcing newly mastered skills. So, adolescents often enter therapy reluctantly, feeling that their autonomy has been taken away. I think the goal is for the to help the adolescent understand the true nature of the therapeutic relationship, not to tell them what to do, but to work together to find what's important to them and how to achieve their goals. Um, language like, I'm not here to dictate to you or tell you what you must do. I'm sure you have plenty of people doing that already. I'm here to work with together with you to understand what's important to you and how you want to live your life. And we'll figure out how you can be as effective as possible in getting the things you want and how we can better align the goals you and your family have set. So that key again is establishing trust, avoiding being perceived as an agent of parents or other authority members, and to empower the adolescent to take an active role in the process. So, as with most things, the SIFTA work is really crucial in terms of building that strong relationship initially, um, getting the adolescent beyond their quote unquote problems to understand how to enhance their own intrinsic motivations for change, recognizing that the adolescent comes to therapy. Perhaps in a one down position and may be prepared to resist attempts to change them. And again, avoiding being seen as an agent or even an ally of caregivers or outside institutions. Um, yeah, I mean, I think before we can expect to see any major behavioral changes, we really need to understand that it's important to enhance the adolescent's motivation and align with their own agenda. So the concept of reluctance versus resistance in therapy, SIFTA challenges the term resistance as it places all the responsibility on the client. Instead, SIFTA recognizes the reluctance to engage in therapy is often reasonable and understandable. And this approach acknowledges that therapy methods themselves can create the very resistance therapists don't want to encounter. So, um, in this case, my call out box is providing an analogy to illustrate the difference between reluctance and resistance, trying to push someone without explanation versus inviting them to see something they'll enjoy. Of course, all taken from reading, right? So, again, not a new concept in terms of our conversations here, but many families from diverse cultural backgrounds may be hesitant to seek therapy due to beliefs around privacy and not airing quote unquote dirty laundry in public. So, in traditional or hierarchical family structures, parents of rebellious adolescents may feel weak or defeated and ashamed if they can't fulfill their expected role as effective leaders. So I think therapists need to be sensitive to how their role may be perceived as threatening within these cultural contexts and to attend carefully to the family's hierarchical dynamics. Um, Important again to build trust, demonstrate that cultural humility, and adapt your approach to align with the family's worldview and values. So adolescents, they can sometimes gain really significant power within a family system. So that can sometimes also make it very challenging to engage with them in therapy. We could see this as we might see signs of this power imbalance, like parents waiting for the adolescent who doesn't come home, the adolescents outright refusing therapy with no consequences, and parents basically appearing helpless to enforce attendance. So the key is to reach out directly to the adolescent, explore their agenda, and ensure therapy is working towards their goals. Easier said than done, but we want to convey that we see the adolescent as an individual who can make important decisions, which will help us build that trust and engagement. And our approach should always be collaborative and empowering, not confrontational. So it's important to first assess whether the therapy initiator genuinely wants the reluctant family member involved or if they're making excuses to exclude them. So we need to understand the reasons behind the reluctance. Adults, again, may fear that therapy will focus on their own issues rather than their adolescents' problems. We want to avoid having multiple sessions without key members present, as this can inadvertently strengthen the barriers between the disengaged caregiver and the therapy process of the family. We want to reach out directly to the disengaged caregiver, emphasizing how much their perspective is needed and asking for their permission to include them. We want to start small, asking for their attendance at just one or two sessions, creating an opportunity to demonstrate the value of participation. So, in terms of the psychoeducational models offered by CIFFTA, there are three key areas: mental health, health and wellness, and trauma and identity. So, for mental health, modules under this heading can help families understand symptoms, warning signs, and support for issues like depression, ADHD, self harm, and suicide risk. That health and wellness umbrella is focusing on health promotion, substance use, risky sexual behavior, and just providing education on healthy lifestyles and risk reduction, generally speaking. The trauma and identity modules is addressing specialized needs with cultural sensitivity, so including a trauma module and a gender identity sexual orientation module, perhaps under this umbrella. So these psychoeducational modules are delivered in like separate didactic sessions as part of CIFFTA's comprehensive approach to supporting youth and families. And I mentioned that there's a book that this is drawn out of that I read, and it goes into extensive detail with all of the various categories. This is just a very brief encapsulation from the article. Um, so CIFFTA's created a number of education modules focused specifically on common mental health challenges. So things like the depression module, again, looking at warning signs of depression, which can often be masked as acting out behaviors in adolescence. It's really teaching families how to support their loved ones and understand the different treatment options, including medication. That ADHD module provides information about the symptoms and daily life impacts of ADHD, and it's also addressing concerns that some minoritized families may have about misdiagnosis or medication. The self harm module aims to reduce stigma and help families understand the difference between non suicidal self injury and suicidal behavior. So it's identifying warning signs and normalizing the feelings of helplessness that families will often experience. So each of these is, again, designed to increase understanding and reduce shame. And the book, as I already just said, outlines in much greater detail what's possible. So, one of the goals of CIFFTA, or one of their core goals, is to help youth and families move towards more flexible and adaptive behaviors. And they really want to emphasize building effective skills, increasing family support and acceptance. So, um, I think the takeaway was that engaging all family members and joining them around issues beyond just the quote unquote problem. Those were some of the four key areas: understanding and helping families address environmental stressors that may be impacting them, assessing and improving the effectiveness of parenting in different domains, and enhancing the quality of family relationships, increasing support, and reducing conflict. The caregiver module is designed to support caregivers in processing information and fostering acceptance after their LGBTQIA youth has disclosed their identity. So it's crucial for the well being of both the youth and the family that caregivers navigate this information in a healthy way. So this particular module has four areas: defining LGBTQIA plus, so just, exploring the diverse identities within the acronym to build understanding, outlining the six stages of identity development model for LGBTQIA youth, addressing the unique experiences of LGBTQIA youth and families from diverse cultural backgrounds, so that intersectionality, and debunking common misconceptions and harmful stereotypes to promote a more accurate and supportive perspective. So The discrimination module is designed to support therapists in addressing the profound impact of discrimination on youth and families. So it's looking at various forms of discrimination. It's providing concrete examples and details of the detrimental effects on mental and physical well-being. So the module is highlighting how discriminatory experiences can negatively influence family dynamics and social connections, emphasizing the importance of collective support. So it includes discussion questions to encourage family members to reflect on their experiences and share personal perspectives. It's helping therapists mobilize family strengths and resources to buffer youth from the chronic stressors of discrimination, and it's empowering parents to take a mentoring role in guiding their children on how to navigate and survive the challenging realities of discrimination. So CIFFTA offers specialized modules to support families and the unique needs of diverse family structures. So that parenting module strengthens the parenting unit by discussing child development, behavior, and effective strategies for caregivers. The blended family module focuses on the dynamics and transitions of joining two families, normalizing the challenges, and helping build new relationships. And the single parenting module is exploring the stresses and coping strategies for single parents, including unique considerations for Latinx families. So, family advocacy modules is addressing or really empowering caregivers to navigate complex systems like legal, school, and psychiatric environments. Um, it's helping address some of the common challenges that they may face, such as intimidation, lack of knowledge, and cultural barriers, just to make it possible for parents to effectively advocate for their child's well-being. That legal system module is focused on helping caregivers understand the juvenile justice system, and it's covering key roles like public defenders and probation officers, as well as intervention points and resources for issues like immigration. So this empowers parents to assert their power and rights within the legal system. The school module facilitates caregiver engagement within the school system or with a school system, and it effectively teaches communication strategies, how to overcome cultural language barriers, and build confidence to advocate for academic and behavior success in a school context. Um, the medication module addresses concerns around psychiatric medication, and it covers the importance of compliance, managing medication adjustments, and empowering caregivers to discuss cost benefits, do like a cost benefit analysis, and express feelings around treatments. So, as I said, there's a book that you may want to purchase that has a lot greater detail than what we were able to cover with the selection of what we read in class, but this is just a brief overview of this program.